This is part 3 of communicable illnesses and infections, and we're going to start with viral infections which have viral exanthems, which is rashes. Many of our viral illnesses have a characteristic rash. Rubella. This is often called the German measles, which has this distinctive rash and enlarged nodes in the neck. This is a relatively mild infection for children, but is devastating if a pregnant woman gets it, and that's why this is one that we immunize against to protect fetuses. Mumps is swollen parotid glands, which is your salivary gland down here in the neck, and as you can imagine, anything that puts a lot of swelling in the neck, you're at risk for blocking the airway. The other reason we immunize against this one is males who get it older, like this boy, teens or into adulthood, are at high risk for developing sterility. They'll get it down in the testes. Measles, which is Rubeola, this is our MMR shot. These are the 3 that are in that, the measles, mumps, rubella. This one is not a mild illness. This one's a serious illness. Fever up to 104 or more, cough, runny nose, watery eyes, and then after 3 to 5 days, a rash, and it's this much more compacted rash. This is extremely contagious. This is one, if you remember a few years ago, somebody went to Disneyland and broke out, and it was spread to a bunch of people. This one you don't have to have close contact, just walking by somebody or through the same room, you can catch it. And as it says, about 1 out of 4 people who get this will need to be hospitalized, and even with that, 1 to 2 out of 1,000 will die from it. So that's our MMR, is those 3 there. We usually, anymore, we give that combined with the Varicella, which is chickenpox, and this has this characteristic rash of vesicles, so these are fluid-filled pox. When the pox dry up and scab over, you're no longer contagious. This one is airborne as well, and kids, if they're immunocompromised at all, this can be very serious. They can get it down in their lungs and have chickenpox pneumonia. Most kids do okay with it, but when adults get it, they get very ill. The immunization on this probably has one of the worst rates of totally preventing infection, but we've just about eliminated those serious cases of kids who get hospitalized with the shot. So the shot's been very effective at eliminating serious infection, but a lot of kids will still get a mild infection even after the immunization. So those are usually together in the same shot anymore. One that's not in that shot is Roseola, and I just did this because we've got Rubella, Rubeola, Roseola. They sound so similar. This one is a mild illness. It's often called the 3-day measles or the baby measles. And, it's a few days of a fever followed by a rash. Almost all babies get it, 6 months to 2 years. It's rare for an adult to have not gotten it as a child, so most adults are immune. If an adult does get it, it rarely has serious complications. And here's the rash that goes with it. Erythema infectiosum, which is 5th disease. This falls in the parvo virus category. Again, a few days of fever, irritability, and then the bright red cheeks. And that's how you diagnose this one, those bright red cheeks. Usually a fairly mild illness on children. Very bad if a pregnant woman catches it. If somebody never had it as a child and gets it during pregnancy, especially that first trimester, can be bad. Hand, foot, and mouth disease. This is coxsackie virus, characteristic little blisters in and around the mouth, on the palms of the hands, and around the feet. These kids are irritable. They don't want to walk because their feet hurt. They often don't take fluids well because their mouth hurts, and that's our concern with them, is that they can get dehydrated. But otherwise, this is a fairly mild virus, but spreads very easily. Moving on to zoonotic and vector-borne infections. The first one we'll start with is cat scratch disease, which, as it sounds, comes from cats. This is a bacteria. Notice how that causative agent is italicized. That's what you do with bacteria names. Many cats are carriers of this in their saliva, and then their fleas will get it. So most transmission actually comes from cat fleas, but it can come from a cat bite. It causes lymphedema, rarely needs to be treated, but it takes our bodies quite a while to isolate and kill off bacteria, so 2 to 4 months of those swollen lymph nodes. The way to prevent this is not let your cat have fleas, so control fleas. And kids get bit by cats usually because they play rough with them, so don't let your kid play rough with cats and kittens. If they do get a bite, you're going to immediately wash it with soap and water. The next zoonotic, so carried by animals, is rabies. This is a virus that affects the central nervous system, comes from the saliva of an infected animal. The incubation can vary from a few days to as much as a year. Most often it's 1 to 3 months. The problem with this is once you have symptoms, it is fatal. We really cannot treat it, not effectively. There's only a few people worldwide who have lived through this. So once you have symptoms, it's too late. So what do we want to do? We want to prevent bites, teach children to not play with wild animals. And for pets, we want to vaccinate pets so that we know they can't carry rabies. If a child does get bit, anytime you break the skin, wash with soap and water, but this one you want to seek care immediately if a child's been bit by an animal that you don't know. So you don't know that it's a vaccinated pet or if it's a wild animal. We will immediately give 2 shots, one of gamma globulin, the immunoglobulin for rabies, which is passive immunity. We're giving that child antibodies against rabies, and then we're going to give them the vaccine for rabies, which is active immunity. It triggers their immune system to make antibodies against it, and we're going to follow that with 3 more doses of the vaccine. Quite effective at preventing them from breaking out. With rabies, the problem is you can't know if they were going to get rabies or not, and if you wait, it's too late. This is vector-borne by ticks, Lyme disease. I think you do this in adults as well, but we'll talk about it here. This is a bacteria carried by deer ticks, so it's only certain types of ticks. If you get a tick or your child gets a tick, remove it quickly. It usually takes a tick being in for 36 to 48 hours in order to transmit the disease. If you do see signs of Lyme disease, you want to start on antibiotics early. We're usually very good at treating this early, but if we wait, it can turn into a chronic infection where all we can do is try and minimize exacerbations. So how do you prevent getting ticks if you're going hiking in a tick-infested area? Well, try and prevent the ticks from getting on your skin. So wearing clothing, tucking the pants into your socks, because the ticks will get under clothing and burrow up and then embed into the skin. So when you get home from an area, you want to check the body well. They're very small. You can see here how small they're, a small black tick. And if you've had a tick bite, this is a characteristic bullseye sign of Lyme disease. So the bite was down here, and then you get this ring around it of red, and that then you absolutely need to get in and get treatment. To get a tick out, you're going to pull it out using fine-tipped tweezers. Protect yourself. Grasp it close to the skin and pull straight out with an even, steady pull. Don't twist, don't jerk. The problem is you can pull, break the abdomen off from the head and leave the head in place. So that's what you're trying to do. Once you have it out, just like anything that breaks the skin, wash with soap and water and take the tick into your doctor so they can look at what type of tick it was and determine if there is a risk for Lyme disease. There are other diseases that ticks carry, but they're not in our area here, so I'm not talking about them. Parasitic, parasites and helminthic infections. Helminths are worms. So we're going to look at head lice, scabies, Giardia a little bit, and then pinworms. So pediculosis, this is a head lice infection, very common among school-age kids. Biggest symptom is that they itch. A louse can live without a human bite for about 48 hours. A female lays the eggs just not against the skin, but just maybe a quarter of an inch away from the skin. They like around the back of the ears and the nape of the neck especially. Those nits take 7 to 10 days to hatch. The treatment is to use a pediculicide shampoo. Follow the directions. Many of them you have to put on the hair dry to make them work. Wash that out. You want to pick out the nits. The problem is that those shampoos will kill all the mature lice and eggs that are getting close to hatching, but they kill the nervous, based on the nervous system. The nervous system doesn't develop until that nit is about 4 days old. So the eggs that were just laid are not killed by the first shampoo. So almost all the shampoos say to do it again in 7 to 10 days. So you let those eggs that were just laid hatch, but not yet reach maturity to be able to reproduce and lay more eggs, and then do the shampoo again. The problem is that louse can live for 24 to 48 hours off of a person. So it can live in their clothing, their bedding, on their teddy bear, in their car seat, on the chair where they lay. So you've got to clean every one of those up. So wash everything in hot water and a hot dryer. If it can't be washed, in a sealed bag for 14 days, long enough that an egg hatches and then dies from lack of being able to feed. And vacuum everything, the car seat, the chairs, the carpet. It's a big job, and many people have felt like they did everything and they still come back. So they're hard to get rid of. You've got to really be thorough. Here's a picture. The nits look a lot like dandruff, except they're glued to the hair shaft. So you touch a dandruff, it flips, you grab a nit, it will pull all the way till it pulls off the end. The lice themselves look like a sesame seed. And here's how to get rid of them. You got to do that cleaning and washing, and it's a big job. So scabies are a little mite that burrow under the skin. They like between the fingers and the wrist especially. They get under there, leave their feces and lay their eggs. But basically you have an allergic reaction to what they have left, the debris under the skin. So you cover the body with it's the same pesticide as used in lice shampoo, but it's a cream that you put on the body, leave it on overnight. It kills them, but you've still got the feces and now dead eggs under the skin, so it takes a while for the itching to go away, and the itching's supposed to be incredibly intense. We do have an oral treatment now that is a single pill. And here's kind of a picture and an electron microscopic picture of the mite itself. Helminths, these are worms. So the most common one kids get is pinworms. Another protozoan, GI protozoan that kids get usually from contaminated water camping is Giardia. So with either of these, you want to find out about exposure. Helminths often come from, if they have pets, they've been playing where the puppy poops. So the best way to test for pinworms is to check the rectum with a piece of tape first thing in the morning before the child's been able to scratch, because they lay their eggs there. So you take the tape and then fold it in half, take it into the doctor, and they'll look for the eggs. For Giardia, usually it's a stool specimen, and they're looking for ovum and parasites. But we need to find out, have they been exposed to those things, and then worry about transferring it, because they both can